Your hands feel numb. Your feet tingle at night. Sometimes it feels like tiny electric shocks, burning or pins and needles. It just won't stop. You try to ignore it. You shake your hands, rub your legs, or walk slowly, hoping it will go away. But deep inside, you worry. Is this nerve damage? And more importantly, can it be repaired? If you are over 60, this message could change your life because many seniors are silently suffering from nerve damage, and most don't realize that one simple vitamin deficiency may be the hidden cause. Even more surprising, when this vitamin is restored, nerve healing can begin within weeks. Let's understand what's really happening inside your body. As we age, our nerves become more fragile. The protective coating around them, called the myelin sheath, starts thinning. Blood circulation slows. Nutrient absorption becomes weaker. And over time, the nerves stop sending signals properly. That's when symptoms appear: tingling, numbness, burning pain, weak grip, unsteady walking, sensitivity to touch, even loss of balance. Many people think this is just normal aging, but in many cases, it's not aging, it's deficiency. The vitamin that plays a powerful role in nerve repair is vitamin B12. Vitamin B12 is essential for nerve health. It helps rebuild the protective covering of nerves. It supports healthy nerve signaling. It helps produce red blood cells that carry oxygen to nerve tissues. Without enough B12, nerves begin to deteriorate slowly and silently. And here's the problem. After the age of 60, the body's ability to absorb vitamin B12 drops significantly. Even if you eat healthy foods, your stomach may not absorb enough. Low stomach acid, common medications like antacids, diabetes medicines, and digestive issues all reduce B12 absorption. That's why many seniors are unknowingly deficient. Let's talk about the warning signs of low B12. If you feel tingling or numbness in your hands or feet, frequent leg weakness, burning sensations, memory problems, fatigue, dizziness, pale skin, or balance issues, your body may be asking for more B12. The good news is that nerve cells have the ability to heal when given the right nutrition. When vitamin B12 levels are restored, the body begins repairing the damaged nerve covering. Blood flow improves, oxygen delivery increases, inflammation reduces. Many people start noticing reduced tingling and better energy within 2 weeks. But there is a right way to take it. For seniors, the most effective form is methylcobalamin. This is the active form of vitamin B12 that your body can use immediately. It supports faster nerve repair compared to regular cyanocobalamin. The typical daily dose for nerve support is between 1,000 to 1,500 micrograms, but it's always best to consult your doctor before starting, especially if you have diabetes, kidney disease, or are taking medications. Now, you may wonder, can food alone give enough vitamin B12? Vitamin B12 is mainly found in animal-based foods like eggs, fish, chicken, milk, and yogurt. But here's the reality. Even if you eat these foods daily, your body after 60 may absorb only a small amount. That's why supplements become important. But vitamin B12 alone works even better when supported by other nerve-friendly nutrients. Vitamin B6 helps nerve communication. Folic acid supports nerve regeneration. Magnesium relaxes nerve signals. Omega-3 fatty acids reduce inflammation. Alpha-lipoic acid protects nerves from damage. Together, these nutrients create the perfect environment for nerve healing. But vitamins alone are not enough. Your daily habits also play a big role. Control your blood sugar if you have diabetes. High sugar damages nerves faster than anything else. Keep your feet active. Gentle walking improves circulation. Avoid long periods of sitting. Movement keeps nerves alive. Massage your hands and feet daily to stimulate blood flow. Stay hydrated. Dehydration slows nerve function. Sleep well. Nerves repair themselves during deep sleep, and most importantly, avoid smoking and excess alcohol. Both destroy nerve tissue over time. Now let's talk about something many people don't realize. Some common medicines reduce vitamin B12 levels. These include metformin for diabetes, proton pump inhibitors for acidity, and certain blood pressure medications. If you are taking these regularly, your risk of deficiency is even higher. That's why regular blood testing for vitamin B12 after age 60 is a smart step. If your levels are low, your doctor may recommend high-dose oral supplements or even B12 injections for faster recovery. In many cases, people who suffered for months or even years of tingling and weakness experienced noticeable improvement within weeks after correcting their deficiency. But remember, nerve healing takes consistency. You must take the vitamin daily. Skipping doses slows the process. And here's something encouraging. Nerves heal slowly, but they do heal. The earlier you start, the better the results. If your symptoms are mild, you may feel improvement in 2 to 4 weeks. If nerve damage is severe, it may take a few months. But the important thing is, healing is possible. Also, pay attention to your diet. Include eggs in breakfast. Eat fish 2 to 3 times a week. Add yogurt or milk daily. Include leafy greens for folate. Add nuts and seeds for magnesium. Use healthy fats like olive oil. These small changes support long-term nerve strength. Now, let's address a common fear. Many seniors worry that tingling means permanent nerve damage, but in many cases, it's simply a nutritional issue. When the deficiency is corrected early, nerves recover well. But if ignored, the damage may become long-term. So if you or your loved one feels numbness, burning, weakness, or balance problems, don't ignore it. Your body may be asking for vitamin B12. One vitamin, one simple daily step, but the impact can be life-changing. Imagine walking without fear of losing balance, holding objects without dropping them, sleeping peacefully without burning pain, feeling steady, confident, and energized again. That's the power of proper nerve nutrition. Before we end, here are 3 quick tips to remember. Get your vitamin B12 levels tested after age 60. Take methylcobalamin daily if levels are low. Support it with good diet, movement, and blood sugar control. Your nerves work for you every second of the day. It's time to give them the support they need. Because healthy nerves mean better movement, better balance, better sleep, and a better quality of life. If this message helped you, share it with someone over 60 who may be silently struggling. Sometimes the simplest solutions bring the biggest relief. Your body is capable of healing. Start today. One vitamin, one step, and your nerves may thank you sooner than you expect.